Yeah, I was going to ask you about this whole muscle mass point. Why is muscle mass so sort of pertinent to this conversation?
So what we know in menopause is that, aging combined with menopause, we see a dramatic loss of muscle mass with the menopause process. And so in that first 10 years of menopause, we could lose up to 10, sometimes 15% of our muscle mass. And that muscle mass is going to determine your resistance to sugars. So your insulin resistance is really tied to your muscle mass. Right. Your functionality, your ability to recover from a fall. And the other thing is what most people don't understand is the musculoskeletal unit acts as one. So when we have low muscle mass, you are dramatically increasing your risk of osteoporosis. Now, right now, this might shock you, but 50% of females will have an osteoporotic fracture before they die. And this is almost completely preventable.
What is an osteopathic fracture?
So osteoporosis is when we lose the density of our bones through, so estrogen, so all of our life, we remodel our bones, right? We chew up bone, we lay down new bone. And so we reach our maximum bone density as females at about age 35. And then it slowly starts to decline through the aging process. And then when we get to menopause, it dramatically, we see just massive loss of bone. So this loss of bone makes the bone weaker and much more likely to fracture when we fall. And so if you fall and break your hip in menopause, 30% of women with surgery will die in the first year. 70% will die without surgery. And that year is marked by horrific pain and not being able to move and just really, really miserable people. And so much of this is preventable. Going on hormone therapy, getting adequate exercise, doing the resistance training, eating the protein, adding in the creatine, making sure you're getting enough vitamin D is going to be huge at protecting my population from this happening as we age. We can prevent the majority of this.